Welcome to the Centers for Medicare and Medicaid CMS Training on Nursing Home Staffing. Let's discuss staffing and the impact to residents in nursing homes and the long-term care survey process. 483.35 nursing services tags were revised at F725, F727, F729, and F732. Key changes made include intent, definitions, procedures, probes, key elements of noncompliance, and deficiency categorization examples. 483.70 administration was revised at F-tag F851. Key changes made include guidance and key elements of noncompliance. Why is sufficient staffing so important, you might ask? Staffing in nursing homes has a substantial impact on the quality of care and outcomes that residents experience. There is a direct correlation between staffing and quality of care. As a surveyor, it is important to understand that direct care staff are those individuals who, through interpersonal contact with residents or resident care management, provide care and services to allow residents to attain or maintain the highest practicable physical, mental, and psychosocial well-being. Staffing is an essential component that facilities must consider when coordinating care to meet residents' needs. Sufficient staffing is also a top concern among residents and their families. This is not surprising when we consider that families are putting their loved ones in someone else's hands every day to help care and provide for them. Let's stop and talk about payroll-based journal, or PBJ. It is not a requirement for surveyors to become an expert in PBJ procedures. However, it is a requirement for facilities that surveyors must survey to. It is an important piece to discuss due to its relation to sufficient staffing. With changes being made to the long-term care survey process, LTCSP software application, surveyors will be able to obtain specific PBJ data prior to the recertification survey. F851 483.70Q is specific to the mandatory submission of staffing information based on payroll data in a uniform format. Long-term care facilities must electronically submit to CMS complete and accurate direct care staffing information, including information for agency and contract staff, based on payroll and other verifiable and auditable data in a uniform format according to specifications established by CMS. Revised guidance at F851 includes that the surveyors can obtain PBJ data from the Certification and Survey Provider Enhanced Reports, CASPER report, to determine if the facility submitted required staffing information based on payroll data in a uniform format. The facility's failure to submit PBJ data as required will be reflected on their CASPER report and result in a deficiency citation. If concerns were identified based on the CASPER report or from any other source, refer to the critical element pathway, sufficient and competent staffing. We'll talk more about this later. F851 has key elements of noncompliance. To cite deficient practice at F851, the surveyor's investigation will generally show that the facility failed to do any one of the following: complete data for the entire reporting period, such as hours paid for all required staff each day, or provide accurate data, or provide data by the required deadline. Remember, The facility is to submit the required staffing information based on payroll data in a uniform format. If the survey team identifies noncompliance, then F851 will be cited. CMS has long identified staffing as one of the most vital components of a nursing home's ability to provide quality care. Over time, CMS has utilized staffing data for a myriad of purposes in an effort to more accurately and effectively gauge its impact on quality of care in nursing homes. The PBJ data provide unprecedented insight into how facilities are staffed, which can be used to analyze how facility staffing relates to quality and outcomes. In 1998, CMS started Nursing Home Compare. Information was originally based on health inspection data. Then, in 2003, quality measures were added. In 2008, five-star rating was added. CMS is continually seeking to improve its value to consumers. CMS posts staffing information on the CMS Nursing Home Compare website, and it is used in the nursing home five-star quality rating system to help consumers understand the level and differences of staffing in nursing homes. It provides consumers with an easy way to search for nursing homes that deliver the quality of care they desire. CMS has developed the PBJ system for facilities to submit staffing and census information. This system allows staffing and census information to be collected on a regular and more frequent basis than previously collected. It is also auditable to ensure accuracy. All long-term care facilities have access to this system at no cost to facilities. The data, when combined with census information, can then be used to not only report on the level of staff in each nursing home, but also to report on employee turnover and tenure, which can also impact the quality of care delivered to the vulnerable population of nursing home residents. Why is CMS concerned about nursing homes that report days with no registered nurse RN on site? F727 requires that nursing homes have an RN on site at least 8 consecutive hours a day, 7 days a week. Research shows the presence of an RN is strongly related to the quality of care and outcomes residents experience. Statistics have shown that as the number of RN hours increases, so does performance on the quality measures. Therefore, when there are lower levels or even no on-site RN presence, CMS is concerned about the health and safety of the residents. Since facilities are required to submit the number of hours staff are paid to work each day, the PBJ data show whether or not facilities have an RN on site each day. While the majority of nursing homes are reporting an RN on site each day, submitted staffing data show that there are some facilities that don't report an RN on site, particularly on the weekends. There are risks that the absence of an RN introduces. CMS believes that the presence of an RN on site every day is extremely important to improving the health and safety of nursing home residents. If a facility reports the absence of an RN 4 or more days in a quarter, they will be cited at F727 by the surveyor. The survey team will use the revised CE pathway, Sufficient and Competent Nurse Staffing Review, to complete the mandatory facility task for the standard recertification survey. This pathway should also be used when surveyors are investigating a standalone complaint, where concerns with staffing were identified. The Pathway has been divided into Part 1 and Part 2. There are general concepts when considering compliance. Quality of life and care concerns, payroll-based journal, PBJ Staffing Data Report, census, resident representative complaints, and/or staff's ability to complete assignments are used to assess if the facility has sufficient staff to meet the residents' needs. Trainings are used to assess if staff retained the information provided by training to maintain the required competencies to meet each resident's needs. Turnover and QAA are used to assess if the facility is operating an effective QAA process. The LTCSP software will be updated to include changes to the survey process to include the PBJ data. The survey team will use this data to investigate further through observations, interviews, and record review. The changes consist of the following 5 areas and are in the form of payroll-based journal, PBJ, staffing data report that surveyors will obtain through the CASPER reporting system. Those areas are based on data submitted by the facility for the last quarter. The first of these is excessively low weekend staffing. This means that the facility has been identified by the PBJ system and triggered for having low weekend staffing. The submitted weekend staffing data is excessively low. This can also trigger a facility to receive an off-hour survey. As we know, F725 requires sufficient staff, so the team would investigate further. The second of the PBJ staffing data report areas include 4 or more days with no RN. This means that the facility PBJ data shows that within the identified quarter, the facility has had 4 or more days without an RN. Remember that according to F727, facilities are required to have an RN on site for 8 consecutive hours, 7 days a week. If 4 or more days with no RN are identified, the team will investigate further and cite the facility at F727. Note that the rule of 4 or more days is used for the purposes of the PBJ Staffing Data Report. The expectation of CMS is that the survey team would consider issuing a citation when a minimum of 1 day is identified to not meet the nurse staffing requirement for a registered nurse. The third of the PBJ Staffing Data Report areas include 4 or more days within the last quarter with less than 24 hours of licensed nursing coverage. At one point, there were about 1,500 nursing homes that reported no licensed nursing staff in a 24-hour period. Per F725, facilities are required to have licensed nursing staff 24 hours a day. If there are 4 or more days with less than 24 hours of licensed nursing staff, the survey team will investigate further and cite F725. Note here also that the rule of 4 or more days is used for the purposes of the PBJ Staffing Data Report. The expectation of CMS is that the survey team would consider issuing a citation when a minimum of 1 day is identified to not meet the nurse staffing requirement for licensed nursing staff. The fourth of the PBJ Staffing Data Report areas includes 1-star staffing rating. We discussed earlier different reasons why a facility may have a 1-star staff rating. If this is identified on the PBJ Staffing Data Report, then the survey team should be aware of this low-star staff rating and as they conduct investigations. For example, surveyors should be alert when interviewing residents about the availability of staff to determine if assistance is provided when needed without having to wait a long time. The last of the CASPER report areas includes No data submitted for the last quarter. If there's no data submitted for the last quarter, it will be assumed that the facility has low staffing. The survey team will investigate further. Surveyors complete the sufficient and competent nurse staffing review. Please note, the rule of 4 or more days is used for the purposes of the PBJ Staffing Data Report. The expectation of CMS is that the survey team would consider issuing a citation when a minimum of 1 day is identified to not meet the nurse staffing requirement for both a registered nurse and licensed nursing staff. There are a handful of staffing-related tags that have revised interpretive guidance and deficiency categorization examples. We talked about 851 earlier. Let's now take a look at some of the other examples. F725, sufficient staff. Procedure, 483.35A, 1 through 2. Compliance with state staffing standards is not necessarily determinative of compliance with federal staffing standards that require a sufficient number of staff to meet all the residents' basic and individualized care needs. A facility may meet a state's minimum staffing ratio requirements and still need more staff to meet the needs of its residents. Additionally, the facility is required to provide licensed nursing staff 24 hours a day, 7 days a week. The facility is responsible for submitting staffing data through the CMS payroll-based journal PBJ system, referred to F851 483.70Q. This data can be obtained through the Certification and Survey Provider Enhanced Reports CASPER reporting system. This PBJ Staffing Data Report contains information about overall direct care staffing levels, including nurse staffing. Surveyors will utilize the PBJ Staffing Data Report available through CASPER reporting system to identify concerns with staffing. The Long-Term Care Survey Process, LTCSP software application, will alert the surveyors of specific dates that require further investigation related to staffing. Surveyors are expected to verify infraction dates indicated on the PBJ Staffing Data Report. If concerns were identified on this report, as well as from other sources, refer to the critical element pathway of sufficient and competent staff and the probes noted below. Some investigative probes in the interpretive guidance have been revised and include, but are not limited to, are the numbers of licensed staff sufficient such that those staff members have enough time to provide direct services to residents, as well as to assist and monitor all of the aides they are responsible for supervising? Does the facility have adequate staff to monitor residents at risk for wandering? Does the facility have licensed nursing staff 24 hours a day? If the surveyor is made aware of the absences of licensed nursing staff in a 24-hour period, interview direct care staff. Interview the director of nursing or administrator. See interpretive guidance at F725 for additional probes. F725, sufficient staff, has deficiency categorization examples, some of which we want to look at today. An example of F725 sufficient staff, level 4, immediate jeopardy to resident health and safety, includes but is not limited to: a resident had complained of chest pain and shortness of breath after eating their evening meal. The nursing assistant stated they would inform the licensed nurse. The nursing assistant was informed there would be no licensed nurse until the next morning. At 10 p.m., the resident was found unresponsive with minimal respirations by a visiting family member. Because there was no licensed nurse on duty at the time, the nursing assistant called 911. An example of F725 sufficient staff, level 3, actual harm, physical or psychosocial, that is not immediate jeopardy, includes, but is not limited to, a resident was admitted to the facility with a recently repaired hip fracture and required assistance with ambulation. The resident used the calling device to request assistance to the bathroom. After several minutes, no help arrived, so the resident attempted to ambulate with a walker to the bathroom without assistance. The resident subsequently fell and was found by nursing assistants. The resident was assisted back to bed by the nursing assistants and complained of pain in the area of recently repaired hip fracture. There was no licensed nurse on duty to assess the resident for any injuries or provide licensed nurse, and the resident was sent to the hospital. The resident was admitted and required surgery to repair the refractured hip. An example of F725 sufficient staff, level 2, no actual harm, with potential for no more than minimal harm that is not immediate jeopardy, includes, but is not limited to, residents complain that they are not allowed choices, such as receiving showers consistently on the days or at times they prefer due to inadequate staffing. A review of staffing data submitted via the PBJ system revealed the facility had a 1-star staffing quality rating. Follow-up interviews with the staffing coordinator revealed that only one CNA was available to provide showers, and therefore residents' preferences for timing of showering could not be met, causing anxiety. Refer to the Psychosocial Outcome Guide for additional direction. Severity Level 1, no actual harm with potential for minimal harm, does not apply. The failure of the facility to provide sufficient staffing, including licensed nurses, creates a risk that is more than minimal harm. Therefore, Severity Level 1 does not apply for this regulatory requirement. F727 is next. The intent of this regulation is to ensure that the facility uses the services of a registered nurse for at least 8 consecutive hours a day, 7 days a week, designates a registered nurse to serve as the director of nursing on a full-time basis, permits the director of nursing to serve as a charge nurse only when the facility has an average daily occupancy of 60 or fewer residents. As previously shared, the facility is responsible for submitting staffing data to the payroll-based journal. Refer to F851. This data for the purposes of standard and abbreviated surveys can be obtained through the Certification and Survey Provider Enhanced Reports, CASPER, reporting system. This report contains information about overall staffing levels, as well as licensed nurse staffing, including the 8 consecutive hours required by an RN. If concerns are identified on this report, as well as from other sources, refer to the critical element pathway, sufficient and competent staffing, and the probes below. Procedure, interpretive guidance, changes include but are not limited to, facilities are responsible for ensuring that they have an RN providing services at least 8 consecutive hours a day, 7 days a week. However, per facility assessment, facilities have requirements at F838 483.70E. Facilities are expected to identify when they may require the services of an RN for more than 8 hours a day, based on the acuity level of the resident population. If it is determined the services of an RN are required for more than 8 hours a day, refer to the guidance at F725 related to sufficient nurse staffing for further investigation. Facilities may choose to have differing tours of duty, for example, 8-hour or 12-hour shifts for their licensed nursing staff. Regardless of the approach, the facility is responsible for ensuring the 8 hours worked by the RN are consecutive within each 24-hour period. Probes. If there is no RN coverage for at least 8 consecutive hours each day, for example, as indicated by the PBJ Staffing Report, corroborate the findings by interviewing frontline staff, example, nurse aides, LPNs, LVNs, director of nursing, or administrator. F727 registered nurse has deficiency categorization examples, some of which we want to take a look at today. An example of severity level 4 noncompliance, immediate jeopardy to resident health or safety includes, but is not limited to, the annual recertification survey of a facility indicates that it provides care for residents with high acuity needs, including residents that receive medications and fluids via central intravenous lines, IV, and ventilator-dependent residents. The investigation revealed an RN was not on site for at least 8 consecutive hours during the day. During the period when there was no RN, the LPN had to perform assessments and maintain central line IV infusions, which is out of the scope of practice for an LPN in the absence of supervision of the RN. The facility's failure to have an RN on duty for at least 8 consecutive hours a day, as required by the regulation, created the likelihood of serious injury, harm, impairment, or death. Specifically, the RN was not present to meet the critical needs of these high acuity residents. An example of severity level 3 noncompliance, actual harm that is not immediate jeopardy includes, but is not limited to, investigation of falls occurring in the facility with a census greater than 60 residents revealed the monthly fall evaluation for one resident was not completed with the interdisciplinary team after the resident experienced 2 falls. Interview with the director of nursing, DON, revealed this was the DON's responsibility. However, because she had been serving as the charge nurse, there was no time to complete the evaluation for this resident who experienced another fall, resulting in a sprained wrist. Record review revealed that the resident experienced a fall after the DON failed to complete the fall evaluation in response to the 2 initial falls. Staff ultimately determined that the resident was falling due to a change in the resident's condition, deteriorating eyesight. That was not timely identified because the DON's failure to complete a monthly fall evaluation. Examples of severity level 2 noncompliance, no actual harm with potential for more than minimal harm that is not immediate jeopardy include, but are not limited to, review of the PBJ Staffing Data Report revealed concerns related to the facility's requirement to have a registered nurse on duty for at least 8 consecutive hours a day. The surveyor verified an RN was routinely on duty for only 7 consecutive hours a day last quarter. No actual harm to residents was identified. However, there was a potential for more than minimal harm due to the facility's failure to have an RN on duty for at least 8 consecutive hours a day, 7 days a week, in order to ensure that all the residents' clinical needs were met either directly by the RN or indirectly by the LPNs or CNAs for whom the RN was responsible for overseeing resident care. Severity level 1, no actual harm with potential for minimal harm. The failure of the facility to provide an RN creates a risk that is more than minimal harm. Therefore, severity level 1 does not apply for this regulatory requirement. For F729, Interpretive Guidance, there have been additions to the Procedure section. Procedure. If concerns are identified with nurse aid services at F725 and F726, review a minimum of 5 nurse aid personnel files, including any specific staff members with whom concerns were identified. Review the nurse aid personnel folder to determine if the facility received registry verification that the individual has met competency evaluation requirements before the employee's start date, unless an exception applies as noted in 483.35 D4. Review the nurse aid personnel folder to determine if the facility verified information from every state registry that the facility believes will include information concerning that individual before the employee's start date. If records reveal a nurse aide has not provided nursing-related services for monetary compensation for over a 24-month period, the surveyor will need to determine if the individual completed a new training and competency evaluation program. F732, Posted Nurse Staffing Information. The intent of this regulation is to make staffing information readily available in a readable format to residents and visitors at any given time. Interpretive guidance has been revised to include the addition of new procedures and probes. Let's review these together. Procedures and probes, 483.35 G 1 through 4. Surveyors must determine through information obtained by observations and verified by record reviews the following. The facility posts the following information on a daily basis: facility name, the current date, the total number and actual hours worked by the following categories of licensed nursing staff directly responsible for resident care per shift: registered nurses, licensed practical nurses, or licensed vocational nurses, certified nurse aides. Resident census. The facility must post the nurse staffing data mentioned above on a daily basis at the beginning of each shift. The data must be posted in a clear and readable format and in a prominent place, readily accessible to residents and visitors. The facility must, upon oral or written request, make nurse staffing data available to the public for review at a cost not to exceed the community standard. The facility must maintain the posted daily nurse staffing data for a minimum of 18 months or as required by state law, whichever is greater. If you're interested in learning more about PBJ outside of what is expected in the survey process, here are some resources for you. Nursing home staffing has a tremendous impact on the quality of care that residents experience. If you have questions about the regulations and guidance included in this training, please send them to the DNH Triage mailbox at DNH_triage_team@cms.hhs.gov. If you have questions about the long-term care survey process, please send them to nhsurveydevelopment@cms.hhs.gov. Thank you for your continued efforts towards our shared goal in providing quality care to America's nursing home residents.